Avoid drum corps injury meltdown this summer. I'm physical therapist Dr. Elliott Cleveland. We work with a number of drum corps and we want to help you get through some of the nagging overuse injuries that we've seen members develop in the last month. Spring training is rough on the body, and one of the biggest things you need to know is that some soreness is okay, but we got to know when there's a difference between being sore and being injured. Here are some signs of that. Normal soreness is achiness or burning or stiffness that you kind of wake up with or feel after a long rehearsal day. The thing you want to watch out for though is sharp pains in your joints or in your muscles, or pains that are limiting your ability to do normal day-to-day activities like walk around, sit for a while, or just stand upright. Those sharper pains are things we want to address. And here's a very simple rule of thumb for you to follow in terms of knowing what to push through and what not to push through. There's an easy scale I want you to think about, a scale of 0 to 10. This is a pain scale. If 10 is we are having to carry you to the emergency room and 0 is no pain, I want you to find the middle line. What is a 5? What does that feel like for you? So if you're feeling some aches and pains carrying your instrument or marching or backwards marching or doing some sort of special choreography, think about if you're having pain right now or you're dealing with a nagging injury. Is that pain less than a 5 out of 10? Or is that pain more than a 5 out of 10? If it's over a 5 out of 10 and you're saying, man, this is getting worse, this is like a 6, a 7, or even an 8 out of 10 every time I try to do this specific motion, that's probably something you need to address. If it's less than a 5 out of 10 and it stays down in that comfortable range where it's maybe a 3 or a 4, just this kind of achiness and soreness, that's probably okay to push through. Now, as you are trying to recover and you're doing some recovery exercises or stretches or a mobility routine in between rehearsals, if you're addressing this on your own or with your medical team, make sure that you are abiding by that. So if you are feeling aches and pains that are a 6 or a 7 or above that 5 out of 10 line, you need to be doing rehab exercises that are slightly different and less stressful than if you were feeling pain that is less than a 5 out of 10. If you were down on this lower side of the pain scale, you can probably do a little bit more advanced exercises. So if you're dealing with a lower body injury, you can probably do some standing exercises or weight-bearing exercises. But if it's more than a 5 out of 10, say you're coming in with a 6 out of 10 knee pain or 7 out of 10 calf pain, you probably need to be doing non-weight-bearing exercises where you're not standing on it and you're doing more band work so you can calm that pain down. Getting rid of the pain or lowering that pain is the key. As you improve, we want you to transition from non-weight-bearing exercises into weight-bearing exercises. Once you have built strength back up in weight-bearing and you are not dealing with that increased level of pain, then you can realize that it's okay for you to be able to push through some of that in rehearsal and do more difficult, challenging things. You should be doing strength work every single day. You should be building up your tolerance to physical activity. Drum corps is really challenging. It's non-stop, and we want you to be your healthiest. In between rehearsals, make sure you're doing not only some recovery exercises, but also some stretching to decrease soreness, some foam rolling to be able to break up some of that soreness, and discussing with the medical team if there's any additional pain relieving activities you can do. If you're not seeing progress, make sure you get to a medical provider locally and get the help that you need. We want you to have a safe summer.